Good evening, I'm Olivia Quay with a special edition of The Big Story. From next Wednesday, July 1st, all patients aged 13 and above who show up with signs of acute respiratory infection will be tested for COVID-19. Currently, those aged 45 and older with ARI symptoms are tested for the virus when they first see a doctor. Even as testing is stepped up, the multi-ministry task force said there is no need to test those who are campaigning during this general election.
Do not require testing to be done for those who are stepping forward to campaign for elections or to stand forward as candidates. However, the candidates or those who are in fact coming forward for the elections, as well as their supporters, must obey safe distancing measures. These have been put forward already by the Elections Department, and they are designed to protect the health and safety of all members of the public, as well as those who are campaigning themselves. And we urge all who are involved in the elections to obey these rules and regulations, which are designed to protect them, their supporters, as well as the public.
Meanwhile, over 900 public health preparedness clinics will be given a one-off grant of $10,000 to support them in their efforts to care for their patients. The task force said the grant will also help defray any additional costs they may have incurred in the line of duty. The Health Ministry will also be providing a one-time swab and send home or SASH startup grant of $1,200 to PHPCs to help defray their startup costs. Finally, an assurance grant will be provided to PHPCs whose doctors contract COVID-19 and are placed on a quarantine order in the course of their work. Eligible PHPCs will be given $500 per day for the duration of their doctor's recovery or quarantine period, allowing them to employ a locum and helping to cover any loss in the revenue. The task force also said it expects about 80% of migrant workers to be cleared of the virus by the end of next month.
Where the migrant worker dormitories are concerned, up to now, we have about 120,000 workers who have either recovered or have been tested to be free from the virus. By the end of next month, we expect about 70 to 80% of the workers staying in the dormitories to be cleared, meaning they will have either recovered or tested to be free from the virus. So by the end of next month, we would have covered quite a large proportion of the workers in the dormitories, and shortly after that, beyond that, we would be able to completely clear all the workers and clear the dormitories, and they would be able, all the workers we expect would be able to resume work thereafter.
There are about 323,000 workers living in dorms. This group of workers make up the bulk of the over 42,700 COVID-19 cases in Singapore. The task force also said it will not lower the DORSCON level back to yellow from its current orange. It explained that while Singapore is in a better situation now, they are continuing to watch it closely to make sure that it doesn't result in complacency among the public, given that Singapore started phase 2 less than a week ago.
We ought not to let our guards down. The important message is that our trouble is not over yet. And you still see a number of cases in the dormitory. And therefore, we actually need to maintain our guards and maintain our vigilance. And therefore, we should maintain the DORSCON level at the orange level.
Visit straitstimes.com to catch up on everything addressed in today's press conference. The full conference is also on our YouTube channel, so subscribe by hitting the red button below. I'm Olivia Quay. Thanks for watching.